If you've spent any time around horses, well, you've definitely heard one cough.
Oh, absolutely.
It might be just a little throat clear,
Right.
or maybe it's more persistent, something that makes you stop and think, hang on, is this just a cough or is there something more serious going on?
That's the key question, isn't it?
Exactly. And that's our mission today. We're diving deep into the, well, surprisingly complex world of the equine cough.
It really is complex.
We want to unpack what's actually happening inside when a horse coughs. Look at the crucial differences between acute and chronic coughs, pinpoint the causes, and really importantly, give you the knowledge on how to manage them effectively. So this deep dive is for you, whether you own horses, ride them, or you're just fascinated by animal health.
And it's such an important topic because a cough, it isn't just random. It's actually a fundamental protective reflex. Horses have it, we have it.
Right.
Its main job is basically to clear out the airways that we call the tracheobronchial tree. Think of the windpipe and all those branching tubes going down into the lungs. And what's really interesting, I think, is how many different body systems get involved. It's not just the lungs. You've got muscles, the cardiovascular system, even the nervous system playing a part.
Wow. Okay.
And here's something that might surprise you. Studies have actually shown that somewhere between 10 and even 50% of horses without an obvious infection, they still cough, either at rest or when they're working.
50%. That's huge.
It is. It's much more common than people often realize. And, sometimes the breakthrough for a chronic cough isn't a drug. It's something simple, like soaking the hay.
Really? Just soaking hay?
Yeah, it addresses the underlying trigger in many cases.
Okay, so let's unpack that sound then. What exactly is a cough in a horse?
Oh.
Physiologically speaking, what's happening, I kind of picture it like a built-in cleaning system just blasting air out.
That's a great analogy. A built-in cleaning mechanism, yeah. Physiologically, it all starts when these tiny little sensors, irritant receptors, get stimulated.
Okay, where are those?
They're pretty much everywhere in the airways. Right from the larynx, the voice box, all the way down into the tiniest little air passages, the bronchioles, and even in the lung tissue itself.
So all over the place.
Pretty much.
Yeah.
And they can be set off by all sorts of things. Mechanical stuff, like a piece of dust or feed, maybe pollutant gases, cold air, hot air, inflammation, too much mucus buildup, or chemical signals like histamine, the stuff involved in allergies.
Histamine.
So when these receptors get triggered, the signal travels, mostly along the vagus nerve, kind of a major highway,
Okay.
up to the cough centers in the brainstem, the medulla oblongata.
Yeah.
And that signal initiates that forceful expulsion of air we hear as a cough.
Wow.
It's really quite a sophisticated protection mechanism. And it works alongside another system called the mucociliary escalator.
The what now?
The mucociliary escalator. Think of it like a conveyor belt made of mucus and tiny hairs, constantly sweeping debris up and out of the airways.
Okay, like an internal housekeeping system.
Exactly. Working together with the cough reflex.
So the cough is a defense mechanism, but sometimes that defense seems to go wrong, right? It becomes this persistent problem. And this feels like a really critical point in our deep dive, figuring out, is this a short-term thing or is it a chronic issue?
It's absolutely vital. That distinction, acute versus chronic, is the first major fork in the road.
Why is it so critical?
Because it immediately helps us narrow down what might be causing it. And it dictates how urgently we need to act and what kind of treatment path we might take.
Okay.
So an acute cough,
Yep.
we define that by its sudden onset. It typically lasts, say, up to about 3 weeks.
Sudden onset up to 3 weeks. Got it.
Chronic cough, on the other hand, that persists beyond 3 months, often for months. And that can signal longer-term problems, maybe even permanent lung changes down the line.
Okay, that sounds much more serious.
It can be. And age often gives us a clue, too.
How so?
Well, viral or bacterial infections, the common causes of acute coughs, they tend to be more common in younger horses. Weanlings, yearlings,
Right.
Whereas chronic conditions, especially the big one, equine asthma, we usually see that in more mature horses.
Okay, that distinction makes sense. Acute versus chronic, sudden versus persistent, often younger versus older. So with that framework, let's dive into those sudden acute coughs first. What should we be watching for? What are the usual suspects?
Right, the acute ones, they often seem to pop up out of nowhere.
Yeah.
The most common culprits, well, first up are viral infections. Things like equine influenza that's super contagious, often comes with a fever, maybe some nasal discharge,
Flu.
and equine herpes virus too. Can cause coughing, usually clear nasal discharge, especially hits younger horses. The big clue historically is often how fast it starts and how quickly it spreads through a barn.
The contagiousness factor.
Exactly. Then you've got bacterial infections. Pneumonia is a big one. Can follow a virus or happen if a horse inhales something accidentally that's aspiration or just direct exposure. It can get quite serious.
Pneumonia, right.
Strangles is another bacterial one. Highly contagious again. Fever, snotty nose, those swollen lymph nodes under the jaw.
Triangles, definitely want to avoid that.
Oh, yes. And shipping fever, that's a type of bacterial pneumonia often seen after long, stressful travel. Horses get depressed, cough.
Okay, so infections are major players. What else?
Environmental irritants. People sometimes forget these, like sudden exposure to really dusty hay or bad bedding or just poor ventilation in the stable. That can trigger an acute cough. Even pollen, though, that can obviously become chronic too.
Right, allergies starting up.
Yeah, and don't forget foreign bodies or aspiration. Choke is a big one here. That's food stuck in the esophagus, not the windpipe. It causes violent coughing, and you might see food material coming out the nose. That's a real emergency.
Definitely sounds like one.
Or aspiration pneumonia, if food or saliva actually goes down the windpipe. Again, these are sudden, but the key is they don't spread horse to horse like infections do.
Good distinction. Anything else for acute?
Less common, but sometimes parasitic migrations. In foals, ascarids, roundworms, their migrating larvae can irritate the lungs. And lungworms, horses, can get those from grazing with donkeys. They can cause a cough that might sometimes become chronic too.
Wow, okay, that is quite a list. So if you're a horse owner, what are the absolute key signs, the red flags that say, call the vet now for these acute coughs?
Yeah, there are definitely some critical clues.
Right.
Well, fever. That almost always points towards an infectious cause, bacterial or viral. You need the thermometer.
Temperature check, right.
The speed of onset and contagiousness, like we said, sudden onset spreads fast. Think viral. Sudden onset doesn't spread. Think foreign body, choke, aspiration.
Okay, useful rules of thumb.
And this is a big one. Food coming back through the nose. If you see feed material or saliva coming out the nostrils when the horse coughs or tries to swallow, that's a critical sign. It strongly suggests choke or severe throat inflammation, maybe even aspiration. It's an emergency.
Fluid out the nose, emergency call. Got it.
Absolutely. And then just the nasal discharge itself. What does it look like? Is it clear, white, yellow, green? Is there a little? That gives clues about where the problem might be and what's going on. Inflammation, infection.
Okay, so the owner sees these signs, calls the vet. How does the vet then figure out exactly which of those causes it is? What's the diagnostic process?
It's a systematic approach. It always starts with a really thorough physical exam, listening to the chest, the windpipe, and definitely taking the temperature.
Right.
If they suspect a virus, they'll likely do a nasal swab for PCR testing. That can identify specific viruses like flu or herpes pretty quickly.
Like the COVID tests for people.
Kind of, yeah.
Yeah.
Same technology, different targets. Then endoscopy is a fantastic tool.
What's that involve?
It's a long, flexible camera that goes up the nose, down the throat, and into the windpipe, even the start of the lower airways. Lets the vet see inflammation, mucus, any abnormalities directly.
See inside, literally.
Exactly.
Yeah.
And if they need samples from deeper down, they might do a transtracheal wash, a TTW, or a bronchoalveolar lavage, a BL.
Okay, what are those?
A TTW gets a sample directly from the trachea, the main windpipe. Good for identifying bacteria. A BAL goes deeper, washing a small area of the lung itself to collect cells and fluid. That tells us more about inflammation type, especially useful for chronic cases, but sometimes done acutely too.
So getting samples from the source.
Precisely. Blood tests are also common. A CBC complete blood count looks at blood cells. Fibrinogen, or SAA, serum amyloid A, are markers for inflammation in the body. They tell us how significant the inflammation is.
Correct.
And sometimes, imaging like chest x-rays, radiography, or ultrasound of the thorax can be really helpful, especially if pneumonia or fluid buildup is suspected.
Right, looking for changes in the lungs themselves.
Exactly.
So once you have that diagnosis, what are the main treatment goals for these acute coughs? Is it just about making the cough stop?
No, absolutely not. The number one goal is always to treat the underlying cause. Stopping the cough itself isn't usually the primary aim because the cough is doing a job.
The cleaning mechanism.
Exactly. So if it's a bacterial infection, you need antibiotics, ideally chosen based on what bacteria grows from those TTW samples.
Makes sense.
For fever and inflammation, NSAIDs, non-steroidal anti-inflammatory drugs like phenylbutazone or flunixin, they're like the horse equivalent of ibuprofen. They help make the horse feel better.
Right. Pain and fever relief.
And rest. Rest is absolutely crucial, especially for viral infections, to let the body heal.
Don't underestimate rest.
Never. And if it's contagious, like flu or strangles, strict isolation and biosecurity are key. You have to stop it spreading.
Very important in a barn setting.
Hugely. Even for acute cases, looking at the environment matters. Reducing duct exposure helps recovery.
Yeah.
And of course, if it is shirk, that needs immediate emergency veterinary intervention to clear the blockage. That's a whole different level of urgency.
Okay. That covers the acute side really well. Now let's pivot. Let's talk about the chronic coughs, the ones that just seem to linger and linger. These sound more insidious, potentially having a bigger long-term impact. So what does it mean when that cough just doesn't go away?
Right, when it drags on for weeks, months, the whole picture changes. The absolute most common cause of chronic cough in mature horses is equine asthma.
Equine asthma, is that like human asthma?
Very much so. It's an inflammatory airway disease. You might have heard older terms for the severe form, like heaves or RAO, recurrent airway obstruction.
Heaves. Yeah, I've heard that term.
It's basically an allergic reaction. The horse's airways become hypersensitive to inhaled allergens. The biggest culprits are usually dust and mold spores, especially from hay and straw bedding. Sometimes pollen, too.
So it's an allergy in the lungs.
Essentially, yes. And allergic inflammation. And the classic signs are that persistent cough, especially during eating or exercise, but also increased effort just to breathe, even at rest.
How can you tell they're having trouble breathing?
You might notice their nostrils flaring or see their abdomen working harder to push air out. Over time, this can lead to a visible ridge of muscle along the flank. That's the classic heave line. It's muscle hypertrophy from the constant effort.
Wow, you can actually see the effort.
You can. You might also see some nasal discharge, maybe some wheezing sounds when you listen to their chest. And a really key clue. The symptoms often get much worse when the horse is stabled, especially if they're eating dry hay and bedded on straw.
Stabling and dry hay are triggers.
Oh.
Okay. Is equine asthma the only cause of chronic cough?
It's definitely the main one we see, but not the only one. There's also inflammatory airway disease, or IAD.
IAD.
Yeah, that's considered a milder form of asthma, often seen in younger performance horses. They'll have an intermittent cough, maybe some poor performance, but usually without that obvious difficulty breathing at rest or the heave line.
So similar but less severe.
Generally, yes.
Yeah.
Then you can have chronic bronchitis or even chronic low-grade pneumonia that just never fully clears up. Persistent poor stable ventilation, even without full-blown asthma, can cause chronic irritation and coughing.
Just bad air quality day in, day out.
Exactly. And we should also mention EIPH, exercise-induced pulmonary hemorrhage.
Bleeding in the lungs.
Yes, bleeding during intense exercise. It's common in racehorses. Afterwards, they might cough as they clear that blood from their airways. And then there are rarer chronic causes: sinus infections, problems in the guttural pouches, tumors. Even severe heart failure can sometimes cause a cough due to fluid backup in the lungs.
Okay, so still quite a few possibilities even with chronic cough. Diagnosing this must be quite involved then, trying to sort through all that.
It really can be a puzzle. It definitely requires a very thorough approach. It always starts with a super detailed history from the owner.
What kind of questions?
When did it start? How long has it been going on? Does it happen at certain times like feeding or in the stable or during exercise? What's the horse's environment like? Bedding, feed, turnout, all those details are crucial clues.
Playing detective.
Absolutely.
Yeah.
Then a full physical exam, paying really close attention to the respiratory system, listening carefully over the lungs and windpipe for any abnormal sounds, wheezes, crackles, checking for that heave line.
Listening closely.
Sometimes a rebreathing exam helps. You hold a bag loosely over the horse's nose for a minute or so. It makes them breathe deeper, which can exaggerate subtle abnormal sounds or even trigger a cough, making things easier to assess.
Okay, amplifying the signs.
That's exactly. Endoscopy is often used again to look for inflammation, mucus, structural issues in the upper airways, and trachea. But for these chronic inflammatory conditions like asthma and IAD, the bronchoalveolar lavage, BAL we mentioned earlier, becomes really important.
The BAL, right. Why is that so key here?
Because analyzing the types of cells in that fluid wash from the deep lungs tells us a lot about the type of inflammation. Are there lots of neutrophils that suggest asthma or maybe chronic infection? Are there mast cells or eosinophils? That points more toward allergy like milder IAD or summer pasture-associated asthma. It helps differentiate the conditions.
So the specific cells point to the specific problem.
Precisely. A TTW might still be done if we suspect an ongoing bacterial infection is part of the picture. And imaging X-rays or ultrasound can show chronic changes in the lungs, like scarring or thickening of the airways.
Okay, so history, exam, listening, maybe rebreathing, endoscopy, and definitely that BAL fluid analysis. That's quite the workup. Now, this feels really important. You mentioned how environmental triggers are huge for equine asthma. What's the absolute cornerstone of treating these chronic coughs, especially asthma?
You've hit the nail on the head. The most crucial part, the absolute foundation, is environmental management.
More important than medication.
For long-term control of equine asthma, yes. Medications can help manage symptoms, but if you don't change the environment that's triggering the inflammation, you'll be fighting a losing battle. The meds will just be a temporary fix.
Okay, so what does good environmental management actually look like? Give us the practical tips.
Right. The goal is drastically reducing exposure to those dusts and molds. So, dust reduction in feed. This is huge. Soaking hay for about 10 to 30 minutes before feeding dramatically reduces airborne dust and spores.
Just dunking it in water.
Yep. Or even better, steaming hay in a dedicated steamer. That kills more mold spores too. Using haylage, which is fermented forage, or switching to complete pelleted feeds are also excellent low-dust options.
Soaking, steaming, or switching feed type. Got it.
Next, bedding. Straw is often really dusty and moldy. Switching to low-dust alternatives like wood shavings, cardboard, or paper bedding makes a massive difference.
Get rid of the straw.
Often, yes. Then ventilation. Stables need excellent airflow. Open doors, windows, ridge vents. Good ventilation dilutes and removes airborne irritants. Honestly, for many horses with severe asthma, the best solution is 247 turnout on pasture, if pasture allergens aren't their main trigger, which can happen sometimes.
Fresh air is key.
Absolutely. And finally, cleaning practices. Muck out stalls when the affected horse is out of the stable, and crucially, avoid sweeping the barn aisle when horses are inside. That just kicks up a huge cloud of dust for them to breathe.
Simple things, but they add up.
They make all the difference. Environmental control is non-negotiable for managing equine asthma effectively long-term.
Okay, that's crystal clear. Environment first. Then what about the medications? How do they fit in alongside these changes?
Medications are definitely important, especially for controlling flare-ups and managing inflammation. They play a vital supportive role.
What types are used?
There are two main classes. First, bronchodilators. These drugs help relax and open up the constricted airways, making it physically easier for the horse to breathe. Think drugs like clenbuterol orally or albuterol inhaled.
Opening the pipes.
Exactly. Second, and arguably more important for the underlying issue, are corticosteroids. These are powerful anti-inflammatories that directly target the inflammation in the airways, which is the root cause of asthma.
Steroids. Okay.
They can be given systemically orally like prednisolone or by injection. But increasingly, we prefer using inhaled corticosteroids, things like fluticasone or biclomethasone, delivered via specialized equine inhalers or nebulizers.
Why inhale?
Because it delivers the drug right where it's needed in the lungs, with much lower doses and far fewer risks of systemic side effects that you can get with long-term oral or injectable steroids. It's much safer for long-term management.
Targeted delivery, fewer side effects. Makes sense.
Then sometimes mucolytics might be used. These are drugs that help break down and thin thick mucus, making it easier for the horse's own clearance mechanisms, like that mucociliary escalator, to remove it.
Helping clear the gunk.
Yep. And antibiotics.
Yeah.
Only if a secondary bacterial infection is actually confirmed by tests like a TTW or BAL culture. They do nothing for the underlying allergy or viral causes.
Right tool for the right job.
Exactly. And for some really severe persistent allergy cases, allergen-specific immunotherapy, basically allergy shots, like might be considered, but that's a more specialized long-term approach.
Okay, so it really drives home the point, doesn't it? A cough is always just the symptom. It's not the diagnosis itself. And figuring out the why is everything. The whole picture is really complex.
It absolutely is. And the critical takeaway has to be that treatment needs to target that underlying cause. Just suppressing the cough symptom itself isn't the answer. In fact, using cough suppressants without knowing the cause can be downright dangerous.
How so?
Well, you could be masking a serious pneumonia that needs antibiotics, or even, in rare cases, a heart condition causing fluid buildup. The cough is a warning sign. Also, interestingly, even bronchodilators, while helpful, need care. In some specific lung conditions where airflow and blood flow aren't matched properly, opening up airways can paradoxically worsen oxygen levels in the blood sometimes.
Wow. Okay. So need to be careful.
Definitely need veterinary guidance. And one more thing to remember. Even after an infection, say a virus, is completely gone, the cough can linger for weeks.
Why is that?
Because the lining of the airways, the respiratory mucosa, gets damaged by the infection and inflammation, it just takes time for that delicate lining to fully heal and get back to normal function. Patience is needed.
That's a really good point. It's not instantly better once the bug is gone.
Exactly.
Yeah.
Which all circles back to the vital importance of getting your veterinarian involved early for any cough, especially if there's fever, nasal discharge, lethargy, or if it's just persisting. Early diagnosis and the right treatment make a massive difference to the outcome and the horse's quality of life.
Okay, well, you've definitely armed us with a ton of valuable information today. We've really journeyed through the layers of equine cough, understanding that critical difference between acute and chronic, recognizing the signs and seeing how vital cause-specific treatment is.
Yeah.
And for those chronic cases, wow, that focus on environmental management as the absolute cornerstone.
It really is key. And maybe this leaves us with a final thought, a question for you listening. Given just how much environmental factors do influence your horse's respiratory health, what's one simple change, maybe something we talked about today, that you could implement right now to improve the air quality for the horses in your care?
And how might that seemingly small change impact their breathing and their overall well-being in the long run? It really emphasizes that power of observation, making those changes, and working proactively with your vet. That partnership is what leads to the best outcomes for our horses.